This is KGW News at 5.
Good evening, everyone. First here at 5 o'clock, a push for COVID safety at Portland Public Schools. Students say the district isn't doing enough. They point to things like classmates not wearing masks in the hallways. And they ask why some schools closed during COVID surges and others didn't. Joe Ranieri explains.
Senior Maddie Rose and freshman Min Dippold go to class at McDaniel High School.
I see multiple with their masks down, multiple wearing the cloth things that you wear when you ski that don't really do much.
Most of the time, they go worried.
It's bad. I'm home right now because I have a sore throat, but I'm also home right now just because I feel safer.
They're worried because of the high rise in COVID-19 cases that continue to climb every day.
We have a main staircase in our school that kind of connects the main floor to the second floor. And between passing periods and lunch periods, it is so crowded that every time I walk up it, I just hold my breath.
And they feel the district isn't doing enough to keep them safe. They also want to know why their school was temporarily closed and moved to virtual learning a couple of weeks ago when several other schools in the district remained open.
I think a lot of us were pretty confused, when we got shut down out of the blue, but it wasn't like a district-wide or, a whole everyone. It was us, and I think it was Cleveland. And there wasn't any sort of real communication as to why that was happening.
I spoke to Jonathan Garcia, who's the chief of staff with the Portland Public School District. He says he understands the concerns students have.
We continue to rely on public health expertise to inform our decisions and to inform our standard operating procedures.
Garcia says there shouldn't be any reason students don't have masks.
We also have and are deploying in real time, KN95 masks for staff. And we also have a number of masks, millions of masks available for students.
As for how they determine what schools would stay open and which ones would go back to online learning,
we review a number of data, including staff attendance data, student absenteeism rates, and then the number of cases, COVID-19 cases that we know about.
The one thing these students want everyone to understand, though.
People aren't understanding that when you feel any bit of a symptom that you should be home.
Joe Ranieri, KGW News.
Meantime, millions of people are ordering the InHome COVID test kits from the Biden administration website, mostly without problems. But there are some issues. KGW's Pat Doris is here with a look at the rollout of the program. Pat?
Well, Laurel, the post office is handling the actual ordering and then delivering of these kits to our homes. They say a small percentage of people did have some problems. It's things like the computer thinking that your house address is really a business and then denying the order, or issuing 4 tests for an entire apartment building, and that's obviously not right. In the Portland area, I talked with some folks who did have problems, 2 homeowners who were denied. They don't know why it happened. Ruth Langlois was thrilled that the government launched such an ambitious program, but then she was a bit down when the ordering site said her address had already asked for the test kits. It had not.
We should have the best and the brightest working on all of this, and it's a big country too. There's lots, so maybe they. It seems like they would have said it's crashed or something. I think I would have been better if it crashed, but just this fear of the unknown is kind of disheartening.
Yep, I understand. It did not crash, by the way. We also heard of at least one fake email that looks very similar to the confirmation email that the Postal Service sends after you do place your order. But this one asked for credit card information, and the viewer who alerted us to it wisely stopped when it asked for the credit card information. Even though it was just $3, they probably would have taken a lot more. And just to be clear, it does not cost anything to order these or to have them delivered. Now, some of you have rightly pointed out that, well, there is a cost because it's all taxpayer money, but you get the point. You don't have to put anything out of your pocket right now. Back to you.
Thank you, Pat. The Biden administration is also making 400 million N95 masks available to Americans. Health experts say N95s protect people against Omicron better than cloth masks. The White House says the free masks will ship this week, and they'll be available at pharmacies and community health centers starting late next week. Oregon's latest COVID numbers don't tell the full story of hospitals right now. Although this Omicron surge looks to be less deadly, healthcare workers are still overwhelmed. Galen Etland has the big picture for us.
Candace Macarone is an ICU nurse in Corvallis.
We're doing the best we can.
She loves her work at Good Samaritan Regional Medical Center, but is tired.
More death in our ICU in the last 2 years than we have, in my career.
And with the mounting Omicron surge, she knows the work is not over. Oregon Health Authority reported an average of nearly 8,000 new COVID cases per day since the holiday weekend, up from the Delta peak of about 3,000 last summer. About 900 people are in the hospital, nearing the record set by Delta.
Our intensive care unit is, if not full, nearly full most days and nights.
But it isn't just COVID, it's everything else too.
People held off getting checked out for their heart, and then they had a heart attack, or they have been having headaches and come in and they've had a brain bleed.
Very anxious about what's ahead of us over the next month.
Dr. Doug Merrill at St. Charles Medical Center in Bend says ERs are overrun.
Headed for basically triple their normal volume.
Those are real numbers, and that's a real problem.
Dr. Ralph Yates at Salem Health says his hospital was at 112% capacity last week and is shifting some patient checks to a gymnasium.
We will be doing more of that as we need to.
And even if there is room, Good Sam CEO Laura Henham says there's more to it.
We don't have enough people to provide the care.
Even though there's an empty bed doesn't necessarily mean there's somebody to take care of that patient.
The good news is Omicron appears to be less deadly. OHA reported about 30 deaths in a week of this January, compared to about 250 at the Delta peak. OHA does not record which variant is tied to these deaths, though. The 10 most recent deaths this week were all people 60 to 90 years old, and at least half had underlying conditions. Hospitals also say people who are vaccinated are not ending up in the ICU. So the message is the same. Get vaccinated and boosted, stay masked indoors, and distance for those at risk. At the end of the day, it all helps healthcare workers like Candace Macarone.
I need a little bit of a refresher. I think we all do.
Galen Etlin, KGW News.
An update now on the recall election in Newburgh. Right now, Newburgh School Board Chair Dave Brown and Vice Chair Brian Shannon are beating a recall vote 52 to 48%. The pair have been mired in controversy after leading the effort to ban all political symbols on school grounds. At first, the ban only included Black Lives Matter and LGBTQ symbols, but the board later expanded it. It could take up to a week before all the votes are counted and we know the results. That's because this is the first election under Oregon's new voting rules. So mail-in ballots that are postmarked by or on Election Day will count. A specially trained team of officers tasked with ending gun violence is officially on the streets of Portland. The focused intervention team deployed for the first time late this afternoon, and our Mike Benner was there. He joins us live from the Portland Police Bureau's North Precinct with more. Mike?
And Laurel, that focused intervention team, or FIT for short, is made up of 12 officers and 2 sergeants. And just last week, they wrapped up more than 60 hours of training, and right now they're putting that training to work. Around 3 o'clock this afternoon, FIT members loaded into their rigs and headed out for the first time. There may have been some jitters and nerves, but they weren't obvious to us. This team looked ready to go. They basically replaced the gun violence reduction team that was disbanded a couple of years ago for, among other reasons, allegations of racial profiling. What makes FIT different from GVRT is that they'll be working alongside a community oversight group. Chief Chuck Lavelle says that's a critical component. What FIT will be doing is so important because we're coming off a year that saw more than 1,200 shootings, 386 people injured, and 69 people killed. And already this year, 5 people have been killed, none of which is lost on those who joined the Focus Intervention Team. I caught up with one member before he hit the streets.
Being new to Portland, I immediately recognized that gun violence was an issue. Last year, we had a record number of homicides, and no police officer, no member of the community, and no one else could say that that's okay. And in my heart, I feel I can do something to help that problem.
All right, back out here live. That officer who you just heard from says that he will be focusing on building relationships with neighbors, adding that ending gun violence is a community effort and one that will take some time. This won't happen overnight. Laurel?